We have two athletes. Neither can goblet squat in an optimal fashion. One is limited by skill, one by capacity. This will compare the two squats and discuss why there is a skill or capacity limitation, what those limitations are, and finally examine the relationship between skills and capacities. A combination of many skills and capacities are required to squat optimally. Skills such as balance and capacities including inadequate cross-sectional area or hip, knee or ankle mobility. The first athlete is a youth cross-country runner who is a novice and has never squatted before. It is clear he's wobbly and unbalanced. He initiates the squat with an anterior knee movement, barely moving his hips back at all, so he comes to his toes and he can't access the full range of movement as his centre of mass is in front of his base of support, causing him to lose his balance. Squatting is a balance skill, and as a novice he could be unaware of the correct movement patterns and body positions, but at this point it is unclear if there are insufficient capacities limiting posterior hip movement too. The second performer is a recreational CrossFit goer who has been squatting for several years. She's aware of the ideal technique but struggles to reach full depth. She initiates the squat with her hips and markedly pushes them back. Her knees don't move very far anteriorly, meaning she has a greater forward trunk lean and finishes slightly above parallel. She does maintain full foot contact at all times, but because she sits back too far, her centre of mass is too far away from her base of support, so she is slightly off balance and compensates by using the goblet pushed out in front as a counterbalance. The novice initiates the squat with his knees, barely pushing his hips back, so is off balance. The crossfitter initiates with her hips and markedly pushes them back, with minimal anterior knee translation. Her depth is limited slightly and she has a greater forward trunk lean. The runner reaches full depth but has to come onto his toes and is completely unbalanced as he stands and wobbly throughout, whereas the crossfitter maintains foot contact holding the goblet out in front as a counterbalance. The youth has come forward onto his toes to counteract his centre of mass, which is too far forward. In contrast, the crossfitter's centre of mass is too far behind her base of support, possibly because her knees are unable to translate anteriorly, i.e. a capacity, or because she doesn't have the correct motor pattern, i.e. a skill. Deciding whether these suboptimal movements are due to insufficient capacity, skill, or both involves logical investigation, knowledge of squat biomechanics and physiology, as well as the history of the athlete. The novice may have a lack of skill and need coaching time. Pole squats provide a counterbalance, check whether the athlete can get into the required positions, and teach the correct initiation and movement patterns. Changes in the neuromuscular system must occur to be able to perform the task through practice and exploration. Once balance and motor pattern has improved, he is encouraged to practice to learn how to use his body, combined with some cues to encourage sitting back and correct weight distribution. He pretty quickly cracks it, indicating his suboptimal squat was largely due to a lack of skill. You can see the improved initiation pattern with simultaneous posterior hip and anterior knee movement, meaning his centre of mass is over his base of support. Although not perfect, he is much more stable, less wobbly, and he maintains full foot contact with much better weight distribution. Although largely a lack of skill, there's still some suboptimal techniques such as the turned out toes and slight forward trunk lean, possibly due to inadequate capacity, for example hip mobility, or even anthropometrics, or inadequate skill. We can't tell without additional investigation. The combination of excessive posterior hip movement, inadequate anterior knee translation, and forward trunk lean to maintain foot contact could imply inadequate ankle dorsiflexion, meaning her ankles don't allow her knees to come anteriorly, a capacity limitation. There could still be an element of skill with the balance and the marked posterior hip initiation, so we'll check using the weight-bearing lunge test. This is used to assess ankle weight-bearing dorsiflexion to gauge ankle range of motion. A reduced weight-bearing lunge test of less than about 12 cm demonstrates limited dorsiflexion range of motion and means less knee flexion and ankle dorsiflexion when squatting. This indicates bilateral ankle dorsiflexion restriction with the right side worse than the left. This could be due to bony, ligamentous or muscle factors, with the right side worse due to articular restrictions from the injury. However, there is bilateral restriction, so self-myofascial release combined with mobilisation techniques aim to release any soft tissue restriction and increase range of movement. Raising the heels allows the knees to go into anterior translation, reducing the demand on the ankle. Demonstrated here where the knees are now able to move more anteriorly, the squat is deeper, the torso is more upright, the goblet is held tight to the chest as the centre of mass is over the base of support, so she's more balanced. In summary, skills and capacities are not independent. The coach must understand whether it is a skill or a capacity which is the limiting factor, and how to address it. Cues won't work to utilise the skill if there's an unaddressed limiting capacity. However, if the required capacities are present, the skill must be taught appropriately in order to get the desired effect and improve the appropriate capacity. Thanks for watching.